Hello, my name is Kathryn Pautz. I will be a senior at Strongsville High School this fall. I was an intern in the Science Internship Program for Nursing this summer at Fairview Hospital. My research project is on the use of ketorolac for pain control in the laparoscopic cholecystectomy patient. Laparoscopic technique is widely preferred among surgeons today. It is less invasive than conventional surgery. Minimally invasive surgery causes patients the least amount of physical trauma. It is known as the keyhole technique. Patients can be treated on a day or overnight basis, leading to a faster recovery period and a decrease in the cost of stay. Laparoscopic cholecystectomy is the removal of gallbladder with the use of a laparoscope. The abdomen is inflated with air or carbon dioxide in order to view the abdomen clearly. Ketorolac is a non-steroidal anti-inflammatory drug known as an NSAID. It is mostly given intraoperatively and provides pain control for 4 to 8 hours without the same side effects that can be presented with narcotics. In the post-anesthesia care unit, pain management is critical because patients are dependent on the nursing staff to control their pain in order for a more efficient recovery period. What I wanted to test is that do laparoscopic cholecystectomy patients who receive ketorolac intraoperatively experience less pain than patients who do not receive ketorolac intraoperatively. To test my hypothesis, a literature search was performed using the following words: laparoscopic cholecystectomy, ketorolac, anesthesia, pain management, postoperative and recovery period, I also performed a retrospective study of medical records. Certain variables that were taken into consideration include age, sex, medications given, body mass index less than 40, and postoperative pain scores. 210 medical charts of patients who underwent a laparoscopic cholecystectomy were reviewed from 2008 to May of 2011. 168 of the 210 patients were female, 48 were male. Exclusions included in the study included ages less than 18 and greater than 70 years, a body mass index of 40 or greater, and patients that had had a laparoscopic cholecystectomy and another procedure in the same setting. The following pie chart is comparing patients that were given ketorolac to those that were not given it. Out of the total charts reviewed, 53% of the patients were not given ketorolac and 47% were given it. The preceding pie charts are comparing the pain scores at 15 and 30 minutes in the recovery room. Each chart shows the pain scores from 0 to 10, 0 meaning no pain at all, and 10 being the worst pain imaginable. In some cases, the pain scores at 15 and 30 minutes were not available. These unattained scores are denoted as NA. The pain scores were taken from the reviewed medical charts. At 15 minutes, patients with ketorolac had pain ranking from 3 to 5, where patients without ketorolac had pain ranking from 6 to 8. Therefore, patients who were not given ketorolac experienced greater pain than those who are medicated. At 30 minutes, patients who were not given ketorolac had pain ranking from 3 to 5 or 6 to 8, compared to patients that were given ketorolac whose pain was ranking from 3 to 5, which is a tolerable amount. At 30 minutes, the pain is much more tolerable in patients who have had ketorolac postoperatively. There can be a decrease in the need for postoperative pain medication, a decrease in the patient's time spent in recovery, a decrease in the pain scores at 15 and 30 minutes postoperatively, although there may not be a significant difference in the postoperative pain scores when comparing a large number of candidates. Recommendations include to seek IRB approval, to also design a study that should be developed for methods of pain control postoperatively, including, but not limited to, medication interventions, calming techniques, music therapy, and lighting in the patient's room. Regardless of intraoperative medications given, pain management should remain a top priority among nurses. I would like to give a special thanks to Elizabeth Hawk, Mary Michelle Duns, James Thompson, Fayakemi Osundina, Chelsea Carolyn, and Nedra Starling. I hope you enjoyed my presentation. Thank you for your time.